Namaste, hello and welcome. I'm Kritsween Valia and you're watching this Network 18 special panel discussion. We all know the word flu. Sometimes we call it seasonal fever or mostly confuse it with a common cold. But influenza or flu is not something you should take lightly. It affects millions of Indians every year, can lead to severe complications, and yet it's often ignored. That's why today we're gathered here and asking a very important question: flu vaccine liya kya? It's about protecting children, mothers, families and even healthcare workers. And to help us understand why flu vaccination matters more than ever today, I'm joined by an eminent panel of doctors. First up, Dr. Hema Divakar, Medical Director, Senior Consultant, Obstetrics, Gynaecologist, Division Director, Well Women Healthcare, FIGO is with us. And Dr. Parvaiz Kaul, Vice Chair, MENA ISN Influenza Stakeholder Networks, Editor-in-Chief, Lung India, is with us to take this conversation forward. Is also Dr. Neelam Mohan, Senior Paediatrician and President of Indian Academy of Paediatrics 2026 and Senior Director, Medanta Hospital, Gurgaon. Welcome to all of you. Thank you for being with us and thank you for talking about this very important issue, something that you've been pressing for time and again. I want to begin with Dr. Parvaiz because the first thing that comes to our mind is our respiratory health, right? When we talk about flu or we talk about common cold. Now we're here, Dr. Parvaiz, to dissect facts from fiction. Let's start with basics. Many people believe flu is just like a cold. And tell us then, what is the real difference between influenza and common cold? Before we talk about vaccine liya ya nahi.
Yeah, I mean, it's basically a common conception with everybody, not even the common people, but even with the healthcare providers at times, that influenza or flu and common cold are the same. They look similar in terms of their presentation, but they are vastly different. They start off with a runny nose, sore throat, maybe some fever, cough, but extreme exhaustion. And severe headache is more a feature of flu, but not very common with common cold. Nonetheless, there may be very difficult. It may be very difficult for people to tell apart flu from common cold.
We're here to spread awareness about this whole notion of flu and how it's different from common cold. You must tell us, how does it impact our respiratory system then, and most importantly for high-risk patients like the elderly or those with asthma, diabetes, heart conditions, what does it really do to your system internally?
So as I told you that there's a good number of people who may recover without any intervention. But there is a possibility if you are in the vulnerable groups, some of them you mentioned, if you are less than 5 years of age or more than 50 years or 65 years in the Western world, or you have an underlying comorbidity like a chronic lung disease, a chronic heart disease, diabetes, if you're pregnant, a healthcare worker, or somebody has an immunocompromise as a result of the drug or because of underlying disease, like somebody has cancer, somebody has an immunological disorder, somebody has AIDS. Non-respiratory complications are in the form of an increased prevalence of heart attacks, strokes in patients who get influenza, and that is where prevention comes into play.
Okay, now a very important question, since we're talking about vaccination, possible solutions, it's a forward-looking story that we're focusing on. Let's cut to present. If annual flu vaccination can prevent hospitalizations, can prevent people from reaching that health deterioration point that you're warning against, why is it still not a priority in India? What more needs to be done?
For a long time, we did not know that flu circulation does happen in India. It was only in 2004 onwards that there was a collaboration between the CDC of the USA and the Indian Council of Medical Research. We looked at the strain surveillance across the country and we've documented that influenza does really circulate in this country as well and causes a lot of lower respiratory tract infections and complications because of that. And that is why we need programs like this to generate awareness amongst the people who are at risk and even the healthcare providers who are the primary custodians of the health of the community.
So we've spoken about people at risk, we've spoken about the importance attached to this mission that you all are on. Let's talk about now what it means for other categories, for instance, women, children, and to take that conversation forward, we're going to go across to Dr. Hema. Dr. Hema, expecting mothers is something that must be spoken of, also because there's another generation that's going to lead to.
Sure.
In that sense, how important is it? How risky can it be if you don't go for this kind of a shot during pregnancy?
Namaskar again. Thank you, Kritsween. Whenever a pregnant patient walks into my consulting, and then it's not the usual problems, but she says, just like Dr. Parvaiz said, I have a bit of cold, I have a headache, I am exhausted, etc. The first thought that comes into my head, flu vaccine liya kya? Why? Because pregnancy is also in the category, just like little children, just like elderly, it's also a high risk category, because the immune system which has to fight out these infections, it's not at its best. It is compromised to an extent in pregnancy. The heart and lungs also undergo several changes because there's a growing demand for the circulation of another life within herself, and these are the situations where we cannot ignore it just like a flu. We cannot just ignore it like a common cold, like he said, because the chances that it may get more serious, it may lead to complications like pneumonia, more number of hospital admissions, maybe an intensive care, maybe life threatening. That's for the mother. And the baby, again, the growth is compromised, and also premature deliveries, miscarriages, a whole basket of problems just with something which looks like a flu.
So you spoke about the importance it carries for the mother. Can you elaborate a little bit about what this means for the child to come? Because a lot of international guidelines, national guidelines do recommend this. Tell us a little bit about the significance it holds for the child, for the future child.
See, the beauty of the flu vaccine given to the mother when she is pregnant is that the mother will prepare the fighter cells so she can fight against the flu. The same fighter cells get transmitted to the little baby, and we believe that this baby is born protected, because for the first 6 months a newborn cannot be given the flu vaccine, and God forbid if it gets into an infection and the mother has not taken the flu vaccine and therefore she has not sent the fighter cells across to the baby, it's a disastrous situation. So it's a dual protection. It protects the mother for sure, but also through the womb to the baby, and also later on through the breast milk. All these fighter cells are so crucial for the little newborn.
It carries such a beautiful thought. Now that you've simply put it, you also say that women are health custodians of their families. What do you tell mothers, wives, daughters watching us today, watching this special episode today, about their role in showing keenness, in participating in this kind of a movement through vaccination for their better future and families?
For centuries we've been telling that women eats last and she eats the least and she takes care of everybody else except herself, but now we have to flip it to the other side, and a huge movement is starting in the country starting tomorrow, and several camps are being put up right across. It's called Swasthya Nari Sashakta Parivar, which means if the women of the house is healthy and well, she leads the way for the wellness of her entire family. So your health is in your hands.
That's beautifully put, and really underlines how a mother's health decision safeguards the entire family. We're talking about families, and we can't forget children or leave children out of the scenario. So let's take it to that perspective. Let's go across to Dr. Neelam. Children are especially vulnerable, and doctor here did talk a little bit about that, the first 6 months and how they stand protected if a pregnant woman is vaccinated in time. But tell us why flu hits children harder than adults.
The immunity of a child develops after birth, majority of the time. They don't carry it. That's why the first 6 months it's very important that the baby has the immunity which the mother gives. So one of the reasons is an immature immunity. So you're not able to fight it out well. And because you have less immunity, then the virus multiplies more. And because the virus multiplies more, you have a higher viral load, and you end up, shedding the virus for a longer time, like 7 to 10 days you may shed in a child. Anybody who is less than 5 years definitely needs to be protected, because if you talk about deaths which Dr. Parvaiz was highlighting, if there are 1 lakh deaths in the country annually, almost 25 to 30,000 deaths are in less than 5 years.
Dr. Neelam, the Indian Academy of Paediatrics also recommends flu vaccination every year for children under 5. You just spoke of children under 5 specifically. Why is this kind of annual protection important? Let's talk a little bit about that.
Very nice question. So why do we say annual protection? Number one, the virus is smart. That also keeps changing, it mutates. So we call that antigenic drift. So whatever vaccine you had last year may not be very effective this time. So that's because of the change in the virus. Second, the immunity that you get through the vaccine would start weaning off after 6 months to 12 months, and that makes you more predisposed to infection. So these are the predominantly 2 reasons that you keep saying annually. And also we insist for less than 5 years, from 6 months to 5 years of age, that you must get your annual protection. It is not only that it protects the child, because the child, as I mentioned, is more predisposed to complications and severe infection, hospitalization, pneumonias, and even sadly deaths that have been more reported in under 5. So, and the second thing is, if you protect the baby or the child, you know, I said to you that they shed the virus for a longer time. So the other members in the family, like, you know, grandparents and vulnerable, like a pregnant women, they also get more infections. So I think by protecting them indirectly, you're protecting the family and community at large too.
We've heard how the flu affects the lungs, how it can endanger mothers and babies, and how children need extra protection more than anything else. Clearly, flu vaccination is about protecting every stage of life. I think that's one thing that gets concluded very, very clearly through this interaction we've had so far. But there's one question that I want to put to each of you. Let's begin with Dr. Parvaiz, since we're also talking about another variant, at least in the national capital, making headlines for a lot of people. I think it's the H3N2. Tell us a little bit about that, and tell us why is it that despite having affordable flu vaccines in India, there is limited awareness, limited people who are willing to opt for it willingly. Is it hesitancy? Is it lack of awareness? What do you think is the reason really?
I read about a survey which was done about in around 11,000 households, and they found that there is a presence of an acute respiratory infection in nearly 70% of them. And most of this viral infection is because of influenza, and the influenza strain that is circulating right now in Delhi and the national capital region is H3N2, which is slightly different from the H1N1, but is contained in the vaccine that is being promoted for the season that is coming for the influenza. That apart, influenza uptake of the vaccination is poor. And it is because of, as I said earlier, it is because of the lack of awareness. People have been hesitant about taking vaccines, not specifically about influenza, for every vaccine. And unfortunately, in the current times of social media, bad news spreads faster than good news. And nobody talks about good news, but if there is anything bad, I mean, you know about COVID vaccines. Everybody talked about side effects of COVID vaccine, even though there is statistically robust data to suggest that it was more protective than harmful. So there is definite evidence. So we need to sensitize not only the community, but also the healthcare providers, so they prescribe it. And this is a preventable disease, as said by my co-panelists.
So looking within is really the first step.
Absolutely.
Dr. Hema, when you interact with your patients, do you alert them about this, how they should be vaccinated against influenza? Tell us a little bit about your personal experience and what those conversations are like.
You know, Dr. Parvaiz talked about the healthcare providers being empowered with the correct kind of information, which I 100% agree. And it's equally important to raise the demand from the community itself, because many pregnant patients coming and asking for flu vaccine. Reality that everybody does take what they need.
You've spoken of the lovely audience here. We'll go across to them. They have a few questions to ask of you. But before that, Dr. Neelam, same question to you. Where do you think the problem lies? Myth, hesitancy, low awareness, and what would your suggestion be to healthcare professionals across?
Yeah, so one thing is definitely low awareness. And there are a lot of myths, like I've heard people saying कि vaccine से ही flu हो जाता है. And vaccine has a lot of side effects. So these are little myth busters. And you will find a lot of hesitancy even among the doctors. Because, so I just want to clarify, while we suggest that all less than 5 years should have, please don't forget that older children and adolescents who have any illnesses, they could be asthma, liver disease, kidney disease, they are on steroids, any immunocompromised, they are also a very high risk. So the Indian Academy of Pediatrics does recommend that not only all 6 months to 5 years old children, but all other children and adolescents who are at any high risk because of low immunity, chronic conditions, they must receive the vaccine.
All right, let's open it to the audience. They're going to be asking a few questions to the three of you all. And I'm hoping some of my questions will be asked too. So audience, really putting a lot of hope on you all. Let's start. Please raise your hands and then we'll go across to the doctors for the answer. Okay, ma'am.
Myself, Neelam Bhagi. My question from Dr. Neelam. Flu vaccine, मेरा 5 साल का पोता ले सकता है क्या?
जी बिल्कुल ले सकता है. जैसे मैंने कहा है कि ये वैक्सीन एनुअली लेना होता है हर साल, और अगर वो 5 साल का है तो ज़रूर लेना चाहिए.
क्या इसमें देश का भी फ़र्क है? मेरी ग्रैंड डॉटर अमेरिका में है, वो 5 साल की है, वो ले सकती है?
जी जी बिल्कुल बिल्कुल, क्योंकि CDC गाइडलाइंस USA तो हर एक बच्चे को एनुअली देते हैं.
Thank you so much for that lovely question. Ma'am. Yes, ma'am.
Shall I?
Yes.
My question is to Dr. Hema. As it is written on the screen, flu vaccine liya kya? Shall a pregnant woman also take flu vaccine? If she should, then at what trimester? And does it affect the child in the womb?
What trimester is very interesting. You must tell us. Yeah.
Absolutely. But the answer is yes, every pregnant woman should take. And the second thing about the safety, it is very safe in any period of pregnancy. But we usually give it at the 5th, 6th or 7th month, because I talked about how the fighter cells or the antibodies will cross to the baby, and we need the baby's protection also for the first 6 months. But we sometimes need to give the patient a little early for her own protection if there is a flu in the air, that we give it earlier. Otherwise, very typically in the mid-pregnancy to early 3rd trimester, what we call, before she enters the 7th, 8th month, there is one shot that she takes, and it's like a dual protection. She gets protected, so does her baby for the first 6 months.
Yes, sir. Seated in the second row. Yeah.
सर मेरा सवाल आपसे है कि मेरे घर में बच्चा है मेरा, तो उसके सर बुखार हो गया है, तो क्या मेरे और बच्चों को भी हो सकता है? उसके ना हाथों में और पैरों में भी बहुत ज़्यादा दर्द हो रहा है.
So if it is flu, what happens is that runny nose होता है उसमें. रनी नोज के साथ और वो कफ करते हैं बिकॉज ऑफ शेडिंग ऑफ द रेस्पिरेटरी सिक्रीशंस जो होती है उसकी वजह से ये ट्रांसमिट होता है बाय ड्रॉपलेट्स, बाय एरोसॉल्स, बाय इवन टॉकिंग एट टाइम्स. सो येस, इट कैन स्प्रेड टू द अदर चिल्ड्रन, एंड वैसे ही प्रिकॉशंस लेनी चाहिए जैसे हमको कोविड के टाइम में सिखाया गया था. Use a mask, seclude the person if he is sick. And in children, it's very important to note that, जो मैडम ने बोला, that shedding of the virus normally 8 दिन तक हो जाता है, but in children it can last for weeks and even months. So you have to be very careful that a child is a source of infection for everybody around in the family.
ब्लड प्रेशर और डायबिटीज़ कंट्रोल दोनों, लेकिन सीजनल फ्लू होता है, जैसे मार्च अप्रैल के बीच में और अक्टूबर और नवंबर के बीच में. और मेल ब्लड प्रेशर है लेकिन साथ में अस्थमा भी है, इनके लिए वैक्सीन कैसे आप बताएंगे?
मैम वैक्सीनेशन का जो
और मैं खुद हूँ 70 साल की मेरी एज है.
सो आई मीन
हस्बैंड मेरे 73 हैं.
इस एज ग्रुप में 2 चीज़ें हैं जो आपको वल्नरेबल करती हैं. प्लीज़ मैम.
हाँ जी.
anybody beyond 65 in the West और यहाँ पे more than 50 years.
जी
ये consider किया जाता है vulnerable age for flu complications. That's one. And second, आपके पास diabetes का भी एक comorbidity है. So diabetes and age makes you more vulnerable to flu related complications.
right.
तो इस वजह से आपको फ्लू का वैक्सीन लेना ही लेना चाहिए.
जी.
अब कब लेना चाहिए वो डिपेंड करता है कि आपके जो डॉक्टर्स हैं उनको पता है कि सीजनैलिटी क्या है आपके एरिया की और उसके पीक सीजनैलिटी से 2 हफ्ता पहले देते हैं.
Wonderful, such lovely questions, thoughtful questions, a very interesting audience. I think all my questions have been answered. We're headed to the end of this very special interaction. But before we wrap up, doctors, I'd like to ask each of you that one punchline that all of us present here should keep in our minds and we take it back home. So tell us about that one takeaway or message that you'd want to leave us with. Dr. Parvaiz?
So we know now that flu is a potentially dangerous disease. So protect yourself, protect your lungs, protect your every organ system. Take your flu vaccine annually.
Lovely. Dr. Neelam?
As a mother and as a pediatrician, I would always say children first. So please, you must get your children vaccinated. Do meet your pediatrician to discuss about it and protect your child and protect family.
Okay, lovely. Dr. Hema, your concluding
I
thoughts?
think the concept of buy one take one free always works. So give it, give it to the pregnant mother. She is also protected, and so is the child for the first 6 months. So dual protection is a must.
Okay, powerful messages indeed from our experts, from the doctors who've been looking at this issue for years now. Once again, I leave you with the same question, and this is for you viewers. Flu vaccine liya kya? Do not wait for flu to strike, to come your way. Talk to your doctor, protect your loved ones, and for more information, visit India Flu Protection. Thank you for joining us on this very special panel discussion. To our esteemed doctors, I'm Kritsween Walia signing off. Stay safe, stay healthy. We'll see you soon.